my name is Courtney Lawrence, and I'm going to be doing my Indwelling urinary catheter checkoff for a female patient. So the first thing that I'm going to do before I go into the room is verify the orders and the patient's allergies. My patient is Anna Povolowski. Her date of birth is 7/6/1957. She has an order for an indwelling urinary catheter, and she has an allergy to penicillin. The reaction to that allergy is a rash. So I'm ready to go in the patient's room. I'm going to go ahead and knock and sanitize my hands. I'm going to introduce myself to the patient and explain the procedure. Hi, my name is Courtney. I'm a student nurse, and I'm going to be inserting a indwelling urinary catheter today. I'm going to do a safety check on my patient, so I need to make sure that the two side rails are up, the bed is in the lowest position, there's a call bell in reach, and there's no clutter. I'm going to identify my patient. I'm going to ask for her name, date of birth, and any allergies. She's going to tell me her name is Anna Povolowski. Her date of birth is 7/6/1957. She has an allergy to penicillin, and the reaction is a rash. So I'm just going to verify that with her wristbands and also with the electronic health record. And then I'm going to go ahead and educate the patient on the procedure. So today we're going to be putting in a catheter. The reason for this is because you're having difficulty urinating. So once we place that catheter, it's just going to be a procedure that we're going to do here at the bedside. And it's going to help drain the urine from your bladder and relieve some of the pressure that you're feeling. So I need to ask the patient if she has a history of urethral stricture or if anyone's ever had difficulty placing a catheter in her before. My patient said no, but if she were to say yes, then I would need to contact the healthcare provider and not continue with the procedure. So I'm going to go ahead and gather my supplies. For my procedure, I need a catheter kit, an extra pair of sterile gloves, procedure gloves, tape, and I will also need a hospital-approved cleanser for pericare. So I'm going to go ahead and sanitize my hands. And I'm going to put on my procedure gloves. I'm going to close the curtain for the patient's privacy. Then I'm going to raise the bed to a working height, and I'm going to lower this side rail on the side of the patient that I'm working on. I'm going to make sure that I have enough lighting here that I can adequately do the procedure. And then I'm going to let the patient know I'm just going to expose the lower half of your body. I'll leave the upper half of your body covered by your blanket so you can stay warm. Okay, so now I need to put my patient in the dorsal recumbent position. So I'm going to ask her to relax her thighs, and I'm going to rotate her hips outward. And now I'm going to use the hospital-approved cleanser to provide pericare to the area. After that, I'm going to examine the patient, and I'm going to identify the urethra. And then I can go ahead and remove my gloves and sanitize my hands. Okay, so now I need to set up the area for the procedure. I'm going to go ahead and remove the bag from my kit, and I'm going to place it between the patient's legs. I'm going to be using this bag as my garbage throughout the procedure. So I'm just going to go ahead and tape it up here. Okay, so I'm going to go ahead and pull back my flaps. And now I can apply this drape to the patient. I'm going to touch only the shiny side, and I'm going to place the shiny side down. Okay, so I'm going to leave that there, and I'll fix it once I have my sterile gloves on. I'm going to sanitize my hands. And I'm gonna go ahead and put on my sterile gloves. Normally, if I were doing this in person, I would have a table to my side, and without turning my back to my sterile field, I would apply the sterile gloves on that other table. But for the sake of this video, because I don't have enough room, I'm just gonna move this out of the way so that you can see me apply the sterile gloves, and then I'll move it back. Okay, so I'm going to toss that in the trash. Now that I have my sterile gloves on, I'm going to move this drape, or the sterile field, back into place. And now I can go ahead and put the fenestrated drape on. Before I put the fenestrated drape on, I'm going to go ahead and reposition this drape. And then I'm going to go ahead and put my fenestrated drape on. Okay, now I can go ahead and start organizing my kit for the procedure. The first thing that I'm going to do is ensure that my drainage bag is clamped, and it is. The next thing I need to do is pour this antiseptic solution onto my cotton balls. And then I'm going to go ahead and squirt the lubricant onto my tray. Okay, so now I need to remove the catheter cover. And I'm going to place this in the lubricant. Okay, and now I can attach my syringe. Okay, so now with my non-dominant hand, I'm gonna go ahead and separate the labia, and I'm gonna keep this here now. I'm going to go ahead and use my forceps, grab my cotton ball, and first I'm going to cleanse the farthest side, then the closest side, and then the middle. Okay, now I can pick up my catheter. And I'm going to ask the patient to bear down gently. I'm going to go ahead and insert the catheter. Until I see urine, and then another 2 to 3 inches. So now that it's in place, I'm going to use this hand to hold it, and I'm going to inject slowly. Okay, now I can release this hand and remove the syringe. And I'm going to pull gently to make sure that it's in place. Okay, so now I need to grab my tape. And I'm going to secure this right above the bifurcation onto the patient's leg. Now we can take our drainage bag, unfold it, and we're going to connect this to a non-moving part of the bed lower than the patient's bladder. And I'm going to coil this excess tubing, and I'm also going to check to make sure that there is no obstruction in the tubing. So with this catheter, you're going to ensure that the bladder drains completely, or you're going to allow the bladder to drain completely unless your hospital has a separate protocol for that. I'm going to go ahead and clean up my area, remove all of this trash. And then if I need to, I can go ahead and perform any perinatal care. So now I can remove my gloves and sanitize my hands. And I'm going to put the patient in a more comfortable position. Okay, so now before I do anything else, I need to check on the safety of my patient. So I'm going to lower her bed back down to the lowest position. I'm going to put up the side rail that I had put down, make sure that there's 2 side rails in place. I'm going to give her her call bell. I'm going to make sure that there's no clutter in the area and that the brakes are locked on the bed. Next, I need to take a look at the drainage bag and measure the amount of urine. I'm going to ask my patient, is there anything else I can do for you? If she says no, I'm going to ask, is this a comfortable position for you to be in? She says yes, then I'm going to go ahead and sanitize my hands. And then I'm ready to document. So the things that I need to document after inserting a catheter would be the amount, color, and clarity of the urine, the size of the catheter, which our catheter was a 14 French, and also the amount of water that was in the syringe, sterile water that was in the syringe that we used to inflate the balloon, and that was 10 mLs. And that's it.